Hey everybody, Ian here from Live Aquaria. We are back with another Tank Talk episode. This week's pre-recorded episode is on infectious diseases of aquarium fish. Thank you so much for watching and enjoy.
Infectious diseases of aquarium fish. When we talk about infectious diseases, we're talking about bacterial, fungal, and viral infections. In this talk, we're only going to discuss the common bacterial and fungal infections of aquarium fish. In order to diagnose the infectious diseases of fish, it's important that we understand the history, which is things like how many fish are in the aquarium, how long have they been in the aquarium, are there new fish that have been added to the aquarium recently, and also things like when was the water changed, were any medications previously used, because these will help us determine what likely is part of the problem. The environmental assessment is the filtration systems and the size of the tank, the number of fish in the tank, if they're overcrowded, if they're showing any other problems that are associated with the physical water and aquarium and lighting and filtration, those type of things. The water quality parameters are probably one of the most important things to look at, and that's your ammonia, nitrite, nitrate, pH, hardness, alkalinity, salinity, chlorine tests, phosphorus tests, the different things we can test for in the water. The physical examination of the fish includes looking for injuries, damaged fins, discoloration, ulcers, anything that's abnormal or unusual when you look at that fish. And then from there, we may take biopsies of wounds, of the fins, gill tissue, and make cytology samples, which would be looked at under the microscope. For larger fish, such as koi and bigger tropical fish, maybe cichlids, we can even do blood tests, especially for bacterial infections. Blood tests are one of the better ways to do bacterial cultures. Cultures could also be taken from wounds or other skin issues. And then if the fish is dead, we would do a necropsy, which means looking at the dead fish, including internal organs, and maybe even taking some samples for histopathology, which is a special staining of tissue samples to look for parasites, bacteria, fungus, or other abnormalities in the tissue. So for collecting these biopsies, most of the time we'll take the fish out of the water, put it on a wet surface like a wet towel, using gloves that are wet. We can take samples from the skin mucus, from the fins, from the gills, and these can be done on the fish while they're alive without hurting the fish. It can be done under anesthesia using something like MS-222, tricane-methane sulfonate, which is a fish anesthetic that gets placed in the water, tranquilizes the fish. You can take it out, handle it, make your samples, and then put the fish back in clean water where it'll wake up. These samples are placed on slides, which is now called cytology, which means we're looking at the cells. And we'll look at this under the microscope, sometimes with staining, sometimes without stains on it, to make things appear so that we can see them under the microscope. Histology is when samples are collected and fixed in formalin, and then they're placed with special stains, Wright stains, Giemsa stains, hematoxin and eosin stain, or acid-fast staining, to identify different structures in the cells or different type of microorganisms that could be in it. And then there are other chemical tests that we can do on some of those tissues. And then even electron microscopy, which is using electrons rather than light to see the tissue, which means we can see it at much finer detail and smaller sample sizes. And then we can do cultures for bacteria, viruses, and fungus. So the first thing we look for are bacterial infections, and these can be caused by a variety of different bacteria, including the motile gram-negative rod bacteria such as Aeromonas, Pseudomonas, Enterobacter, and Flavobacterium. Now, while these are the most common of the bacteria that cause fish diseases, these are also bacteria that live normally in the water without causing disease. So this, again, brings up the importance of a healthy environment with good water quality, because the bacteria are almost always present in the aquarium. It's only when the fish get injured or sick or just stressed from the water quality that these bacteria start becoming a problem. Non-motile gram-negative bacteria are the short rods, including Aeromonas salmonicida acromogenes, and this is one that causes ulcer disease in koi, for example. It's a common one. Gram-positive Coccobacilli bacteria, Mycobacterium, fortunately is not as common, and it can also be a normal inhabitant bacteria in the aquarium environment, but this one can cause some chronic diseases, and we'll talk about those later. The treatment for these would be using antibiotic medicated food or giving the fish antibiotic injections. The choice of antibiotic is based on testing the tissues for this appropriate species of bacteria and what antibiotics those bacteria are sensitive to. Just randomly adding antibiotics into the aquarium water is not very effective, may not work, and may even cause more problems because you're not using the right antibiotic to get rid of the bacterial infection that's causing the fish disease, and you may be damaging the bacteria that lives in your biofilter, which is very important. When the bacteria get inside the fish, they can get from a wound in the skin, for example, into the bloodstream, and they spread through the body by the blood. That's what's called septicemia, which means bacterial infections in the blood. They can get into different organs. They can cause congestion of the blood vessels, so that's why sometimes the fins will start looking red. The skin can become inflamed, get ulcers, which are open sores on the skin. They can get into the liver and kidney and cause damage there. The kidney necrosis can lead to ascites, which is a fluid accumulation in the body because the kidney is no longer pumping the extra water out of the body. It can cause hyperplasia of gill filaments, which makes the gills look whitish or have some mucus on them. Under the microscope, you'll see them becoming thickened, and you'll even see a lot of white blood cells in either skin scrapings or in the gill biopsies. Here's a great example of pinecone disease, a photo of a koi taken by Dr. Helen Roberts. And you can see how the scales are sticking out from the body wall, and the body is very rounded because it's full of fluid. This body is becoming edematous, meaning it's retaining fluid, and the abdomen has ascites, which is fluid accumulating in the abdomen. And this can be due to bacterial infections affecting the kidney, so the kidney is no longer excreting sufficient amounts of water. Fin rot occurs when the bacteria gets through the small capillaries in the fins, causing blockages, which then will cause tissue necrosis. So on this top picture, you can see where the fins are starting to get reddened as the capillaries become inflamed and swollen, and eventually it'll cause necrosis. On the lower picture where you see these cichlids have their fins starting to rot off, and it can occur in other parts of the skin as well. And so this is one of the signs that are seen with bacterial infection. Bacterial ulcer disease can cause hole in the side problems, including a disease called furunculosis. A furuncle is a raised reddened lesion, and you can see that these lesions started as the skin becoming inflamed and reddened. Then the skin sloughs off, leaving a hole or an ulcer. And then you can see the muscle, the red tissue is the muscle beneath the skin. The ulcer has gone right through the epithelium into the muscle layer beneath. And then some of these koi on the bottom, it goes deep into the muscle and even into the abdomen, so that the inside of the fish is totally exposed to the water. So the water is getting directly through the body wall into the fish. And of course, we know that's going to affect the fish's homeostasis. It's not going to be able to control the mineral content and the water balance in its body, and that will result in death. So the signs of these first starts out as skin erythema, which means redness of the skin. Then it gets a furuncle, which is a raised patch of skin. That patch falls off, causing an ulcer, and then the ulcer can continue to grow, leading to death and tissue death and death of the fish. This slide shows typical skin infections associated with Aeromonas bacteria, but it could also be some of the other bacteria we mentioned can cause similar lesions. And here you can see the skin is sloughing off the end half of this guppy's tail. So the caudal peduncle and the tail fin is all becoming necrotic and sloughing off. On the other photo, there are plecostomus that show red lesions on their body. These are caused by maybe trauma originally, and then bacteria get in there, and then this bacterial infection occurs, which causes the skin to become ulcerative or sloughing off. Flavobacterium columnare is one species of bacteria that we can actually identify by looking at it under the microscope. It's so distinctive. And in this case, we can actually see it growing on the skin here, which looks like this white fluffy stuff. Now, that may look like fungus, and fungus can have a similar appearance, but these are actually long strands of bacteria that are growing on the tail of this fish. And here on this goldfish, there's these dense packs of tissue growing on the fish, which are also bacterial colonies growing. Flavobacterium columnare, also called columnaris disease, because these bacteria grow in columns, often described as haystacks, that have long, wiggly bacterial ends seen on the microscope. So in this slide, we see a photograph of a fin biopsy. There's some fin rays visible and then the mucus, but at the very end of the tissue, kind of in the center to the little bit left of the center, we see what's called this haystack appearance, and that's a mass of bacteria. And right on the edge of the bacteria, you can actually see little finger projections sticking out or little columns sticking out. And those are the actual bacteria itself. And these would be wiggling on a wet mount microscopic exam. This slide also shows these big bunches or haystacks of bacteria growing on the edge of the tissue. On this one is a skin biopsy, and you can see the gold pigment at the bottom. That's actually pigmented tissue from the skin. That's the normal fish colors. And then along all this edge, you see the haystack or finger-like projections of the bacteria growing on this sample. Again, in this slide, you can see the tufts of bacteria sticking off from the fin sample here. And also you see this strand of bacteria coming off to the right side. That's just group after group of bacteria, and you see the long individual filamentous bacteria in it. So this is why columnaris is one bacteria that can easily be identified microscopically, whereas other bacteria look so similar that you can't identify them specifically from just an exam under the microscope, which is why we do bacterial cultures and sensitivity. Mycobacterium is a different type of bacteria. It's a gram-positive. It has these chronic lesions in the fish, so it doesn't cause fast demise or damage to the fish. It occurs gradually over time. And in this particular cichlid, you can see the eyeball above, and then there's this pink semicircular area around the nostril area. This was actually a mass, and it was raised out of the tissue, but when we opened the mouth, inside of the mouth, you could see that the mass was visible as well. This fish was euthanized, the mass was removed. The center picture shows this mass on a slide, and the mass, if you look at it under the microscope, it has these granulomatous lesions. So these little granules, there's a little dark center in it. That's where the actual bacteria is, and then the body is trying to wall off this bacteria with tissue, and it makes these concentric, irregular shaped masses which get bigger and bigger, and there's multiple of them because they are starting individually with microscopic bacteria, and then all of these bacteria form individual granulomas, and they make these big lumps. The lumps can sometimes be big, sometimes they can be little, sometimes they're dispersed inside tissue like the kidney, so that you may not see this large mass like we found in the cichlid, but it may be just the kidney looks discolored or the kidney looks swollen or the liver, for example. And when you look at it under the microscope, you'll see the regular liver tissue or the kidney tissue with these granulomas, these concentric circular brown patches inside that tissue. On this slide, we see a guppy with a very swollen abdomen. It would be hard to determine exactly what was causing this abdomen to become swollen, but this fish would be maybe not eating, not active, not swimming. Sometimes they're acting pretty normally, though, up until the time they either die or, in this case, are euthanized. And then you see this large belly. When you open it up and take out some tissue, you'll see, again, these are individual granulomas that are formed inside the abdominal or the coelomic content. So in this case, maybe the intestinal tract or the kidneys or the liver could have had these granulomas inside of them. And as they grow and get larger, they cause destruction of the normal tissue. They can cause necrosis or death of the cells of the normal tissue. So eventually this fish would die. Now the problem is, if this fish dies in the tank, it's very typical for fish to eat dead fish. As those other fish start eating this dead fish, they get the bacteria, and then they themselves can become infected. So the Mycobacterium infection can be a very chronic infection in fish, meaning that it's slow to grow and lasts a long time. The fish don't die suddenly, or it might not even show any symptoms for a long period of time. It can cause bloating of the organs due to the granulomas developing, which ultimately can make the fish not want to eat. So even though it maybe starts looking swollen, but it may not be eating as well and could look skinny, even though it has a swollen abdomen. The fish can survive for long periods of time, and then if they do die or are eaten by other fish, or the bacteria can even be released from the body into the aquarium and other fish can pick it up. So it can slowly spread among fish in an aquarium. It can live in the biofilm of the aquarium, so even though maybe no fish are infected, the Mycobacterium can still be present. And I've heard of even aquariums that have been disassembled and dried out and set back up again, that the Mycobacterium was still present in there because of dried bacteria inside the aquarium in what would have been originally the biofilm. And humans can get this. Usually it's due to having a lesion on your hand when you're working with the fish or working with your hands in the aquarium. The bacteria gets into that cut and then it'll start growing, and it causes a disease called fish handler's disease, which causes red raised swelling on the people's skin. So if you're working with fish and you start seeing skin lesions, it's important to not only go to the doctor, but tell the doctor that it could possibly be from fish aquarium infection, because most doctors won't think of Mycobacterium when they are looking at a skin on a human, thinking that this might be a problem. To make a good diagnosis, what we like to do is a bacterial culture. If the fish has died, the best way to culture it is from the kidneys, possibly the liver, but the kidneys, because the blood flow through the kidneys, make really good sources to sample. If the fish is alive, a blood sample can be drawn. Getting a sample from the blood is better than just getting a sample from, let's say, a wound, because that wound can be infected by a variety of bacteria that were just in the aquarium and are not the bacteria that's actually inside of the fish causing the infection. Make sure when taking a sample, we use a sterile technique so we're not getting external bacteria on the tissue swab that we're trying to culture. The culture goes into a sterile tube in culture media that's sent to the laboratory, which puts it on an agar plate. They grow it. Unlike for mammals, which are grown at 37 degrees Celsius, for fish we culture between 20 and 25 degrees Celsius, which is essentially room temperature. And it'll take about 3 to 5 days for the bacteria to start growing. For Mycobacterium, it can sometimes take 10 or even 20 days to get a good culture. So it's important to give it a long enough time to make sure that the bacteria is growing. Once the bacteria grows in culture, then it can be tested with various processes to determine what species of bacteria it is. And then it can be tested for antibiotic sensitivity to determine what is the best antibiotic used to treat that specific bacteria. Moving on to fungus, there's a variety of different fungal infections that can occur in fish. The most common we see are Achlea or Saprolignia, which are the water molds. Those are the little fuzzy growths that occur on injuries or damage to the fish's skin. You'll see them on the bottom of the aquarium on uneaten food, for example, that drops down to the bottom. And if you leave it there for a couple of days, mold will start growing on it. That's that type of fungus. Branchiomyces is a gill fungus that can get onto the gills and causes the gills to start becoming necrotic. Dermocystidium is a fungus that grows in the skin and can cause cysts or sores on the skin that are usually swollen cysts that have fungal spores inside of them. Ichthyophonus is a fungus that can grow inside the body and can also cause grow behind the eye and cause pop eye, or can cause other masses in the body. Most of the time, the fish that gets these fungus usually have some other injury or an infection or maybe poor water quality, something like that, that's causing the infection to occur. Fish eggs can get infected with fungus, usually the Saprolegnia, and often there's some unfertilized eggs mixed in with the fertilized eggs. The unfertilized eggs will start getting fungus. Once that fungus starts growing on them, the fungus will spread to the other eggs around it, including the fertilized eggs. So you'll see sometimes if you have cichlids, for example, which tend their eggs, they'll look at the eggs and they'll eat or pull off any unfertilized eggs so that they don't get fungus, or even eat the unfertilized eggs so that they don't remain with the fertilized eggs to prevent the infection. And the typical fuzziness you would normally see on fish's skins would be the Saprolegnia. On this slide, we're seeing a necropsy sample of a skin. You can see there's a scale down at the bottom. There's actually a little bit of protozoa, the little round growth at the top. Towards the little left of the center, there's a protozoa swimming around. But these long strands are fungus, and you can see the shaded darker portion at the tips of the fungus are sporangia, where the spores are produced that are released, which then swim through the water and spread the fungus around. So these are often secondary to other types of skin damage or parasites or other injury that can allow the skin to have the fungus start growing on it. They can grow in a variety of temperatures and a variety of salinities, and they have this branching non-septate hyphae. So the hyphae is the filaments, and there's no walls in those filaments going across called septa, but they do branch into different pieces. So one piece will branch off into two. Hydrogen peroxide can be used in the water to help reduce the fungal growth, and it's especially useful to prevent fungus from growing on fish eggs. So how do we treat fungal and bacterial infections? Well, the first thing we always want to do is test the water and improve the water quality. Fish are so sensitive to poor water quality, they will get sick, and even if you're treating them, they won't get better if the water quality doesn't improve. For bacterial infections, we can put antibiotics in their food or give them injections of antibiotics. There are medications that can be put into the water, like the Pimafix and Melifix, which can help reduce the bacterial growth, especially with bacteria growing on the skin. They don't affect bacteria that are inside the fish, only the bacteria that are on the outside of the fish. Hydrogen peroxide can be used to treat fish eggs to prevent fungal infection. Products such as Minfin, which is hydrogen peroxide and peracetic acid, are useful in preventing fungal growth on the fin. Methylene blue can be used in the water to reduce fungal growth and some bacterial growth. We mentioned Pimafix and Melifix, which are plant oil extracts. And then chloramine T, which is another chemical treatment that can be useful, especially for columnare disease. When we're treating tropical aquarium fish, for the most part, the drugs we're using are unapproved fish drugs, meaning they're not approved by the Food and Drug Administration for use in fish. There are some FDA-approved medications, and those have to be used for food fish. You cannot use any unapproved medication for fish intended as food. However, for pet fish, which we're not being consumed, there are other medications that can be used that are not FDA approved. So I wanted just to point that out, that most of the medications we use in the aquarium hobby are not approved for use in fish. However, they're allowed to be used, just not in food fish. Be sure you do read the label very carefully. Make sure you measure your medication appropriately, and also be sure you know the exact amount of water you're treating. Try not to guess. Like a 10-gallon aquarium doesn't really hold 10 gallons of water. Once you start adding the rocks and ornaments and it's not full to the very brim, it might only hold 8 or 9 gallons. So be sure you make sure that the water volume is accurate. So when you add the medicine, you're putting the right amount in. So how do we go about treating the fish? Well, the best way is to take the sick fish in an isolation aquarium or a quarantine tank and treat it there where we know the exact volume of water. We have a smaller volume of water so we can put the appropriate amount of medicine in effectively and economically, and then treat the fish there. Sometimes that's not possible and we have to treat it in the main aquarium. If we put the water in for a long time, meaning we're putting the water in and leaving it in, that's called a bath. Another way of treating is to take the fish out into the medicine for a short period of time at the proper solution, and then putting it back into the aquarium as a short-term dip. If the fish has skin lesions, topical medications can be helpful, and then always for bacterial infections, medicated food is appropriate because we get the antibiotic directly into the fish when we feed it in the food. However, if the fish is too sick, it might not even be eating, in which case an injection of antibiotics might be the way to go. So some of the medications that we use as antibiotics are furanase, tricide neo, kanamycin, oxalic acid, oxytetracycline. Those are commonly used as dips or as treatments in quarantine tank for the fish. Chloramine T is appropriate. It's an oxidizing agent that helps kill bacteria and fungus. Copper sulfate can be used for fungus. Hydrogen peroxide is used for fungus. Malachite green and methylene blue are used for fungus and sometimes bacteria. And potassium permanganate, which is another oxidizer that can help to treat for external bacterial and fungal infection. For fish that have obvious skin wounds, sometimes topical treatments are helpful if it's easy to catch and handle the fish. Sometimes big koi will get these ulcer diseases. You can catch them, treat the wound with betadine is a very good skin disinfectant that you can use to help clear off the damaged tissue, kill off the bacteria and fungus that might be growing on it. You can put Neosporin or other antibiotic ointments directly on the skin and then put the fish back in the water. And that's been shown to help with external bacterial infections to improve the healing rate of the fish. Medicated foods are the best treatment for fish that are still eating that have bacterial infections. And fluorphenicol is available as a veterinary feed directive that can be made into a medicated food. You can also make your own medicated food using some antibiotics that can be mixed in the pelleted food using some egg white or any type of oil that can be put onto the pellets, coating the pellets just lightly, mix in the antibiotic powder in a small amount of the pelleted food, stir it so it totally coats the pellets, spread it out to let it dry. You can air dry it or even put it in the oven about 100, 150 degrees just so that it dries and the oil or the egg white will adhere the antibiotic to the surface of the pellet. Then put it in a plastic container in the refrigerator, and then you can use that on a daily basis in smaller quantities than you would normally feed to ensure that the fish eats all of the pelleted food with the antibiotic on it, and feed it for usually a week, maybe 2 weeks, to ensure that the fish is getting an adequate amount of antibiotic. The best treatment for bacterial infections, especially if the fish isn't eating, is to give the fish injections of the appropriate antibiotic. These can be given intramuscularly along the apaxial muscles which run along the back, or they can be given intracelomically, which is into the essentially the coelom or the abdomen of the fish, where you're going right through the body wall to give the injection inside of the fish, but be careful you're not putting the needle so deep that you might be penetrating into the intestines or ovary or liver. You're just going inside the body wall. Intravenous injections can also be given into the caudal peduncle, which is from the ventral surface into the ventral vein there, that can be hit by putting the needle into the caudal peduncle. Right before you hit the vertebrae, there is a little blood vessel that you can find and put the injection in there. For more information about bacterial and fungal infections, you can go to the liveaquaria.com website and take a look at some of these articles. Thank you.